Lovely. Well, let's make a start, because I said I'd start bang on 2, and it is just that. So welcome everyone. Welcome to the Health Innovation Exchange using digital solutions across the MSK pathway. I'm just doing, there we go. Yeah, so I'm Pete Waddingham. I'm a program manager with the Yorkshire and Humber HSN. I'm going to whip through my bit very, very quickly because I only allocated 5 minutes to myself, and I'm keen to do that because I want to give other people airtime. But the first thing I just want to say is thank you. There's lots of events on, and you know, finding the time in this day and age, I know is difficult for people. So your time is very much appreciated, and I just wanted to start by thanking you. I think most people have seen the itinerary. You know, we're going to have some national and regional speakers talk about the MSK context, and then we're going to go into 3 innovator sessions, which you can jump in and out of depending on what takes your fancy. And there's 2 of the colleagues and myself going to help facilitate those sessions, and as like this event, we are going to record those for people that can't make it. So if you're a little bit camera shy, feel free to turn your camera off if you need to. Just a quick thing from me, just please be sympathetic to this being a virtual meeting. We will have teething problems, I'm sure, along the way. Already I can feel my computer getting hot, wanting to close down, etc, etc. So if you can, just be a little bit sympathetic. I'm hoping to show you a flavour of innovators that the HSN are aware of, covering all areas of the MSK pathway. Now, I'm not going to go into sort of detail of who these companies are at the moment, because you've seen the itinerary and you'll be able to choose where you want to go. But in terms of the pathway, I've looked at that as the digital pathway. So we often talk about clinical pathways, that might be the shoulder pathway, the knee pathway, but I've looked at it as a digital pathway. So what I mean by that is, you know, where are the tools that can maybe help with digital triage? And that could be in primary care, community, secondary care. We know that patient self-care and communication is important. We know that systems, you know, to keep a track of patient activity is important. Then we've got everything like automation right through to remote monitoring. So when I'm saying I'm showing everything across the pathway, I'm meaning this to be the digital pathway, and I'm hoping I'll give you a flavour of some really good companies. I'm excited about the companies that are on this agenda. There's some brilliant organisations that I've got to know really well over the weeks and months. Just a quick thing about the aims and outcomes of this meeting. So obviously I want people to be aware of what digital innovation is out there to support MSK. Now, there are obviously products that have got maybe MSK in the title, but I've also tried to show you some products that are maybe not truly MSK by nature, but what I think can help the MSK problems along those pathways. I'd love it if we built new relationships and get some networks created. I've just highlighted this one because I think it's really important. There's a lot of suppliers on here, and I think it's really important that some of you maybe start thinking about joining conversations together, and that's certainly attractive when we start looking at funding calls. You know, who are those innovators out there that are maybe giving consideration to a bit of the wider pathway? And from companies that I work with in the HSN, I know people do that, and for me, you know, it's really welcome. But obviously as well, we want to make some introductions for you as suppliers to the NHS. I'm going to briefly highlight some current and future funding opportunities, which hopefully will prick people's ears up. And yeah, I'd love to find somewhere that we could take forward selfishly within the Yorkshire and Humber region, of course. But you know, if any of you turned around and said, look, this meeting today led to a relationship that led to a contract elsewhere in the country, I'd equally be happy. So yeah, they're the 4 things that I'm hoping for. I've just put a quick poll in the chat. Now, we had a little bit of teething problems with this. There's 2 questions, but even if you could just do the first one for me very quickly, and it's about, you know, order of, you know, some of the barriers. So if people can, if you just look in the chat, and I didn't think I'd be able to grab that actually because I'm in a presentation mode, but it's in the chat and a few people have tried it. I'm just going to switch to my screen now. Bear with me a second. See if this works. And if people can just have a very quick look at that question, which is, what is your biggest barrier to getting your product into the NHS? And if people wouldn't mind just having a very, very quick look at that, and we'll just get some votes for sort of 10-20 seconds. Don't worry if we don't get a chance to do both questions. We can come back to this during the session. So I'll just pause there for a second. I'm hoping that's working. There we go. I can see some movement. Lovely. Good. I'm not sure people can see my screen because I've gone onto the PowerPoint presentation slideshow as opposed to the Menti, but I will share these results after. Thank you for doing that. Again, I'll just give another couple of seconds. We might be okay. Right, I am going to move on because I do want to not take up too much of other people's time. So let me just quickly see. And again, if I put this question in, there should be another question that pops up. If someone could just shout out if it has done, because I can't see people at the moment. So the question should be, what would you like from this MSK event? And I'll just give that 10 seconds to see if it's working. And as I said, what I might do is I will make this available after the event. So hopefully people, if they haven't had time, and I can see answers coming in. So thank you for that. And again, as I said, I'll just give it another 10, 20 seconds. Lovely. Yeah, establishing relationships with providers. That's brilliant. That's really what I was hoping people would do. Yeah, blue sky ideas about digital solutions. I think you'll see some of that today. I definitely think you'll see there's some great work. You know, people doing work around digital triage and AI, automation, patient comms, lots and lots of stuff. Networking, brilliant. Good. All right, I'm going to go back hopefully to the presentation. So very quickly, and again, I wasn't going to dwell too much on this, but you know, one of the barriers I think is funding. Now, if you haven't checked it out, and I will promote this link, NHSX have brought together what they're calling the Unified Tech Fund. You know, it's a really nice landing page on that hyperlink. You know, £680 million available to NHS organisations throughout, you know, just this financial year. I would love innovators to just eyeball that. Now, some of it you might think, well, that's not funding for us, it's for an ICS, or it doesn't say MSK. If you can, don't worry about that. Just think broader. Think about how could our product, you know, tap into some of those funding sources, and where could we work with the HSN to maybe help partner up. So just to give one example, under that tech fund, there's a productivity funding pot that has things like immersive tech and automation. Doesn't say anything about MSK, but again, that might be something that can help the MSK pathway. I've got Mel Martin on the call, and again, those of you that might have made it yesterday, NHSX did a webinar, the digitalising clinical pathways, of which there's some money available for MSK. And as I said, other pots, I didn't put the perioperative one in there, but you know, pre-assessment, consent process is an area that they're looking to fund at the moment, and that's obviously very relevant to MSK. And then shameless plug, but we as an HSN have a funding bulletin. Please do sign up to that. Have a look on the website. We bring not only that financial information together, but we bring together other sources like the AI awards, SBRI grants, and a whole range, NIHR, lots of stuff, please. So come and talk to us. We're not a silver bullet to getting access to funding or to the NHS, but we do want to help. And I think my computer's just decided to freeze on me. Yeah, okay, I'm nearly done. So just, you know, I'm going to hand over to Andrew Bennett in a second, who's the National Clinical Director for MSK. Again, this is one of those events that I've organised, but I'm really looking forward to listening and joining in myself, because I know there's lots of digital MSK work happening, and I can't wait to listen to Andrew. Then we've got Graham Walsh, Chief Clinical Information Officer in Knee Surgery at Calderdale, and I've got to know Graham over the weeks and months, and again, you know, got a lot of time for him. Brilliant clinician and digitally savvy, and probably a man after my own heart. Like simplicity in technology and things that are functional, and those design principles aren't always easy to achieve. And then we'll go into the breakout sessions. But without further ado, if I can hand over to you, Andrew, and yeah, thank you, everyone.
Yeah, hi. Thanks, Can you hear me okay?
We can, yeah.
Good. I've got a presentation. I will try and share it from here, so hopefully this will work with me. Can you guys see that?
Yes. Yes.
Yeah.
Yeah. It's
good. That's the first hurdle solved. It's the first time I've done this since back on leave, so you sort of get back into autopilot, hey? Look, so my name's Andrew Bennett. I'm National Clinical Director for MSK, for NHS England and Improvement, and that's about 60% of my time. And I'm also a consultant physiotherapist based in southwest London in Sutton Health and Care, which is a community service hosted by Epsom and Helier NHS Trust. And it's a really great opportunity to briefly come and speak about the Best MSK programme and where we are with that, and then how that relates to digital technologies moving forward. So look, I've presented at a number of places with regard to the Best MSK programme, but very briefly, our vision is to enable best lifelong MSK health within all communities, and we want to do that through the sustained delivery of evidence-informed, personalised, high-quality healthcare valued by all. And our mandate predominantly comes from the 2021-22 operational priorities for NHS E&I, where in the context of the pandemic and the challenges associated with restoration, we were mentioned as one of 3 key specialities, along with cardiac and eye care, to be incorporated in the National Pathway Improvement Programme within NHS Improvement. And with that, it gives us the opportunity through restoration to try and reduce the variation in access and outcomes that we know that exist. Of course, this is also a vehicle to drive the ambitions of the long-term plan and the integrated care system planning aligned with the white paper. Now, I just had a text off Mel to say slides are not moving on. Are you able to see my next slide?
No, if you could go to present mode, Andrew, and then just click
sure.
through, just see if they move, because that's it. Now, can you go to present mode, please?
On Teams?
Bottom right hand side, Andrew. Just right at the bottom.
Full screen.
Yeah, full screen. Right at the bottom of your screen, there's near the minus 70%. Yeah, that's the one. That's the one.
How's that?
They've not done anything yet. Did it click?
No. Should I do it this way?
Just click on from beginning and see if that takes you.
Yeah, sure. Let me try again. Hang on. Bear with me. How's that?
Still the same view, I think, as previously from what I've got. I'll tell you what, let me see if I can, will it let me request control?
I can ping them over to you guys quickly if that helps.
What you could do is actually zoom in a little bit in the bottom right, so make that 76% like 100 and then do it from there.
If you try sharing screen, not the window, that might do it.
Okay. Okay, Pete, you've crested control. Does that help?
Well, I was just going to say whether I can I do anything now with your slide deck? I don't think I can.
I can ping them over to you very quickly.
I mean, to be honest with you, it's working for me as long as you just be mindful that you need to obviously manually click your slides as you're working through by the looks of it. But I can see it. Okay, I'm sure others can as well.
So there should be a side with Best MSK Health Programme Vision.
Yeah.
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 Can you see that? Okay.
Yeah.
Yeah, that's visible.
Okay, so as long as you can see that, and if I switch slides now, you can see the change?
Yes.
Perfect. Okay, I'll crack on. Mel, if there's any problems, drop us a WhatsApp message. So basically our mandate is through the 2021 operational priorities, and we want to drive the ambitions of the long-term plan and integrated care system planning. And our primary objective within that is to build on what we've learned during the pandemic, to transform the delivery of MSK services and accelerate the restoration of elective care. But also by optimising MSK provision, we've got the potential to positively impact pressures right across the system: primary community care, urgent emergency care, diagnostics, outpatients. We have a bilateral challenge because we knew pre-pandemic we had a challenge with regard to access, experience and outcomes in MSK services, with a variation in delivery and heterogeneity in quality and value. Post-pandemic, that's been complicated. It was necessary during the phase 1 of the pandemic to pause elective care and to create surge capacity to support the challenge of a disease that we were very rapidly learning about. Of course, the knock-on impact on that is increased waiting times, but also challenges right across the system that we have to deal with. We also manage things characterised by pain. So pain is driven by multiple factors across the biopsychosocial spectrum, and I think it's fair to say we've gone through a pandemic that's affected everybody psychologically, socially and physically. So the presentations we are seeing are becoming more complicated. But with that, we have a massive opportunity, because throughout the pandemic, we developed an ethos, certainly nationally with MSK, of integration and collaboration and co-production, where we drew together the multiple programmes with NHSEI, the work going on within the arm's length bodies such as NHSX and PHE, and work going on within professional bodies and patient organisations around a shared strategy. And we're now carrying that forward in this vehicle that is Best MSK, but it's in a very complex time, because we still have pockets of response. We have the challenge associated with vaccination still, and particular challenges in the rheumatology space with regard to that. We need to restore services. We've got very long waiting lists, but we also have the opportunity not to rebuild to where we were before, but improve. On top of that, we've got restructuring provision with the development of ICS structures, and we've got new ways of working, which can work variably based on my ability to share slides. And we've all been through a massive challenge over the last 18 months and continue to do so. So there's a challenge with well-being. But with regard to restoration of secondary care, our primary focus is around that. And that is a balance of managing risk, controlling demand, and maximising capacity to be as productive as possible. But we can't just look at one specific piece of the pathway to do that. We've got a very good programme looking at high volume, low complexity being driven by GIRFT, looking at productivity in secondary care. But if we don't manage challenges across primary community care, urgent emergency care, diagnostics and outpatients, we are not going to fulfil that outcome we need to fulfil in secondary care about rapidly reducing waiting lists. It's a whole system challenge that we need to focus on. And the role of the Best MSK Health programme is to coordinate that system challenge around and supporting the high volume, low complexity programme. But of course, with that, we have an overarching opportunity to improve aligned with the long-term plan ambitions. And of course, we've got to work with a new integrated care system structure. And we know that to deal with the challenges in MSK services at a system level, we have to facilitate collaboration across primary, community, secondary care, with those with lived experience, with mental health and social services, and with the third sector to deal with the challenges and opportunities we have. So we are at a welcome time where we can take forward the ambitions of triple integration with the new integrated care system structure to try and focus on a more integrated delivery model, which enables Best MSK Health to support people to grow well, work well and age well, and to help to address those inequalities we know we have with regard to access, experience and outcome. The Best MSK programme within that sort of triple integrated model focuses on the whole pathway approach across the life course, very much within the care setting. But it's just to stress that the ethos is very much aligned with those principles of triple integration. And so what does that look like? And I don't really like the term pre-hospital, hospital, post-hospital. But essentially, in a pre-hospital space, in primary and community care, we've got to get our triage right, and we've got to get our supportive self-management right to control demand. In the hospital space, we need to be as productive as we can. And our programme, as I say, is supporting the high volume, low complexity programme, very much focused on orthopaedic and spinal surgery in MSK, but also other programmes focused on restoration, such as outpatients, diagnostics and general elective care. And of course, we've got to get our rehabilitation right. We need to ensure that those people who are having procedures still have the timely rehabilitation to reach their functional goals. So the structure of the programme is split into developing pathways, taking this whole system approach, focusing on orthopaedics, rheumatology, spines, falls, fragility, fractures, osteoporosis and children and young people. And that is supported by work looking at primary and community care delivery, supportive self-management, and we've got a new national speciality advisor, Chloe Stewart, supporting that, diagnostics, workforce, data, metrics, and assurance and delivery in how we can develop a network for MSK through the regions and ICSs to hang this on. And that helps us enable productivity, managing risk, demand and capacity, whilst ensuring we deliver high quality, high value care. Now, those pathways have pathways and pathway supporting areas have work streams associated with them, and some of you may be involved. And those work streams are being led by expert specialists, both from GIRFT and the High Volume Low Complexity programme, but also recognised nationally. And the role within those programs is to provide advice and guidance to the multiple pots of work associated with MSK. A good example is FCP, but also to take a task and finish role about optimizing the end-to-end pathways within specific specialty areas. And these work streams are coordinating representative from NHSEI programs, representatives from arm's-length bodies. Mel is very much involved with this from NHSX, professional bodies, patient groups, and those with lived experience. And we're working very closely with ARMA too. And the idea is to co-produce this strategy to help deliver our ambition of restoration and improvement. And so what does that strategy look like? So that strategy is essentially about enabling local MSK leads who have the best understanding of the population, culture and resources to evaluate local provision and adapt and adopt a series of high impact recommendations, the first version which we produced and sits on our futures site, to try and evaluate provision and optimise delivery. It's not a one size fits all. Across the country, we've got areas which are working really well and areas where we can improve. The idea is to enable local leads to identify those areas and focus their strategy around our recommendations. With that, we are producing cross-system pathways for orthopaedics, spine, rheumatology, falls, fragility, fractures and conditions affecting your children and young people. And we are very much looking at the metrics to measure impact in access, outcomes and experience across that. And one of the challenges we have in MSK is we struggle doing that. We've got decent metrics in secondary care, spinal and orthopaedic services. We've got some national audits, but really we can't measure fully across the whole pathway of delivery, access, outcomes and experience, especially in primary and community care. And then within that strategy, we have a support offer working with our regions and ICS providers and indeed PCNs to try and evaluate provision and apply the strategy. And so where does digital fit to that? So digital plays a massive part within the NHS long-term plan. We are strongly advocating movements to digital technologies to support care prior to the pandemic. Now, I think it's fair to say we've had a revolution in the last 18 months about how we use digital resources, and indeed our ability to present today using Teams, albeit not necessarily successfully sharing the slides, is a great example of that. But I'm sure, as will be described and talked about during this webinar, there are many other examples of digital resources that were developed before the pandemic or have been developed during the pandemic that can help support patient care. But and what we have is we have the Digital Playbook, which is a bit of a resource that identifies those things that are really useful that we can share amongst clinical leads to adapt and adopt where they are. And of course, I'll get it in first. We're looking to get further case studies to support that. But it is not a digital first strategy. And within this digital revolution, we have to consider the challenges associated with health inequalities. And we know that a number of health inequalities have really been focused upon and polarized within the pandemic. Digital is not for everybody. It works for a lot of people, but for other people's it don't. And also, the nature of digital resources we have will work better with certain demographics in certain resources than others. So it's about informing our whole system approach, making the best use of digital technologies, but not putting digital first, trying to use digital technologies in a personalised population health-based model to try and deliver on the challenges we have. And so that's
Andrew, do you mind if I interject, just because I'm conscious of time, and I'd like to bring Graham in just for at least 10 minutes. We've got to go live with our suppliers at 22. I know we've had some technical difficulties. It looked like you got to the end of this slide. Is there anything closing sort of remarks you'd like to?
That's it. I was getting to the end anyway, so that fits perfectly well.
No, very kind of you. And as I said, we've got lots of digital innovators on there, but you've given some food for thought, and you know, outcomes and data and monitoring key to a lot of this enabling pathway, and I hope we see some of that today. Well, we will do. So Graham, I'm going to hand over to you. You've got until 39 minutes past, if that's all right, just so that I can be quite succinct, but we'll make up time if that's all right with you. And you're on mute, I think, Graham. This is why I always like to introduce the slides with "we will have teething problems, be sympathetic." Just while Graham's sorting out, so you've all got the joining instructions for the next session. You know, we will have to be fairly prompt, but yeah, go and have a look at the innovators that you'd like to hear from. Flip between rooms if you want to. Stay in the rooms. If you want to stay in one room only. I've given a range of, you know, you're not just going to see one thing in a room. Graham's going to drop off. Okay, yeah, so I might as well just do my bit of blab now then. So yeah, there's 3 breakout rooms. My colleague Joe's going to help facilitate the first room. My colleague Sophie's going to do room 2, I think, yes, and I'm going to do room 3, and I'm looking forward to that. So as I said, you've got the joining links in the PDF that was circulated. If not, I'll just pop them in as well in the chat, and then we'll come back for closing remarks from Mel Martin as well towards the end. Graham, are we on now? Yeah, that is strange because I've just had a call with you in the last couple of days, no problem whatsoever. I have not got any idea why that would be the case. We'll just give it another couple of seconds to see if there's anything. I think, Graham, just nod your head. Have you jumped off the call and come back on?
Hi, Pete.
There we go. There we go.
I'm
Over
trying to can't get off Teams, so I'm now on my phone.
Okay, well, it's worked.
But the problem is, obviously, my slides are still on the screen.
Email them to me. Email them to me.
We can hear you
While I'm
perfectly.
trying
We
to
can
make
see
it
you.
work, maybe is to talk.
Yes, I think you can wax lyrical, Graham. So let's give some perspective and email me if you want to.
Okay, so my Teams is now restarting. So hopefully, at some point, I won't be on a mobile device. So I'm Graham. So I'm both a CCIO and a knee surgeon. And what I really want to discuss today is how we've used some really simple wearable tech to both improve the outcomes, improve the efficiency, and improve basically the patient pathway for some of our knee patients. And what it's led to is the ability to create essentially a digital day case knee pathway. So I am currently rejoining, so you might get a really loud kind of noise in a minute. Let's see if it works this time. I think we're just proving how well tech works. So I thought here we go now. Let's see, I'm just gonna...
Don't worry as well, because if it's all right with everyone else, we'll just knock forward 10 minutes for the timing. So what was going to start at 22 will start at 10:02. And if it's all right, I mean, we're due to finish at 4:15, but if people are happy just to knock on 10 minutes, and we never have this problem. Yep. I mean, the amount of conversations we've had last week, Graham, on Teams.
Yeah. Can you hear me now?
Perfect.
Perfect. Yay. So basically, what I'll do is I'll get my presentation up. Let's see if this works. So
lovely, we've got it.
Okay, see it now, yeah?
Yes.
Wonderful. Okay, so essentially what I'm going to talk today is about how we've used some of the wearable technology to help us deliver what we, some day case knee replacements. Now, what we want to show is that, the technology, as simple as it is, can help us deliver this. We want to show how the team, including the patient, is fundamental to achieving that, and how we can work together as organisations. And actually, it's interesting, through the NHSX funding that's come out, it's nice to see how within the ICSs, different organisations are now coming together to kind of look at shared pathways that we can deliver. And we want to show how we can both help the organisation, the staff, and the wider NHS. And I'm going to touch briefly on how COVID has changed what we do, because when we started this project, it was very much before COVID, and actually some of the learning points that we had have really helped us recover through the pandemic. So what we know is there's a lot of knee replacement that are done every year. This number is growing, the waiting times are going, and we need to do something to basically improve our efficiency of delivery, but also how we manage patients, how we get patients home, and how we manage them in the community. We normally, a knee replacement would take about 4 or 5 days to get home. So we found that digital reduces length of stay, It gives the patient guidance and sets targets for them. It really does enhance their post-op recovery. The technology frees up staff time and frees up other time within the organisation, which can be really helpful. We use remote monitoring. We were doing video consultations prior to COVID, and I think as you know, as they've taken a much bigger hold within the NHS, I think they really are the future of how we should be delivering our follow-up consultations. So why did we introduce it? Well, we were always we developed day case pathways without digital for a few years within the BMI in Huddersfield, and as I became the CCIO, I suddenly realized that digital, should be at the heart of everything we do. And part of that, we saw that there was certainly a way we could see of improving the pathway by bringing in wearable tech, not only to improve the rate of discharge as the day case, but also to give the patients that kind of guide as they recover, to know that they where they are on their pathway. And actually, when we introduced it, the collaborative working we had with the NHS was fantastic. From the first meeting to the first patients, it was only 6 weeks. And I think that was really testament to, the teams, how they work together. The process was really simple. We didn't deviate from what we'd normally do for a knee replacement. But what I think is really important with any of this tech, we introduced the tech very early. At the pre-assessment clinic, we introduced the patient wearable. We made sure that the patients had the necessary tech, whether it was their own phone, whether it was a relative's phone or somebody with them at home. And that was introduced at the pre-assessment, so it wasn't a shock on the day when suddenly we threw some kind of apps and things at a patient and asked them to use them. Surgery was largely unchanged. We did a few things, but essentially throughout the whole process, it was to normalise the surgical experience as much as possible. And this is a picture on the first day we did it, and these two patients weirdly hadn't seen each other for about 20 years, and they were friends from childhood. And it was kind of weird that we brought them together on the day. Technology, what was it? Well, it's a small wearable that measures the range of movement for the patient. It feeds into an app, and then the app gives the patients the ability to both communicate with therapy staff, but also sets them their goals, and they can see how they're progressing every day, and see, it sets them targets to aim for, but also it gives the physiotherapists and the clinicians the ability to look in and see when they need to act. Is there a patient that's not doing their rehabilitation? Is there a patient that's not achieving their goals? And let's get involved in that patient. So we've now, I think actually this morning I've just done another 4 day case knees, but essentially we're probably up to about 220 day case joint replacements. Of those, we've now probably done about 27 using the wearable technology. I won't go into the process that we follow because, essentially this is probably more about the tech today. But suffice to say, what we found, interestingly, is pre-COVID, we found that only about 35% of our patients were going home as day cases. And what we found is post-COVID, about 56% of our cases. And that's kind of told me one of two things. One is, as clinicians, we're more confident to get patients home because we're now used to more remote working, and I think also probably tells us that patients want to be at home. They don't want to be in a hospital environment around the COVID. So, possibly not relative to digital, but I think it's important how patients' perceptions, I think, have changed. So the results, we had really good compliance. Post-operatively, we had 62% of patients were using the wearable, which I think is pretty good, given these patients are at a pretty miserable time in their lives, in a huge amount of pain from surgery. We found that use of the device regularly correlated with much better outcomes, better range of movement, reduction in pain much quicker, and the more they used it, the better it was. And I think that really was one of the positive findings that we got from this study. We found that therapy massively benefited. It reduced costs because they didn't need to see the patients as much. As they grew in confidence of monitoring the wearable, they got to a stage where they were fairly comfortable that there would be a cohort of patients that they wouldn't need to see, that they could just manage remotely, whether that's on Teams or whether it's simply just messaging the patient to give them that kind of support. You're doing well. And and just on this small kind of pilot, we found that we could make a significant cost saving to therapy services, and confidently I think we can certainly reduce that further. The benefits to the trust, obviously we reduced the amount of bed days. That was a no-brainer. And as we recover from COVID, I think it's quite clear that, you know, improving turnover, improving throughput is what we need, because not only have we had a reduction in, or an increase in waiting times, we've had a reduction in beds, we've had a reduction in staff. You know, anything that we can do to enhance that recovery and improve throughput is going to be a real benefit. And you know, and on the basis of that, there will be a cost saving to the organization. Patients absolutely loved it. They loved, you know, people often see digital as something quite remote. You know, we are sending a patient home, but actually what patients found is that they felt, even though they were at home, we were looking after them. We were kind of watching in on them to see how they were doing. You know, in every part of their pathway, they felt we were with them and they felt part of the team. And I think that made a huge difference to both their compliance and their recovery from the surgery. And they loved the ability to message simple text messages that took maybe 5 or 10 minutes of the physio's time in the morning. Patient had a real kind of, you know, that really answered some of the questions that they might spend ages ringing the consultant secretary, ringing the GP, moving around. So I think that is a real kind of benefit to this technology. You know, these are some of the feedback. You know, it was easy, they liked it. And, you know, going back to Peter's comment about like simple things, it's true. I think simple is best. You know, if it's too fancy, if it's too technical, patients won't engage with it. It has to be readily usable, understandable. And I think patients found, particularly with this tech, it was really supportive to their recovery and made a big difference. You know, the benefits: improve patient care, they improve their own, they take ownership of the care. You know, going home on the same day, you know, the patient isn't a patient, they become, you know, they're responsible for their care. You know, they can have, you know, they're much more compliant. It can bring care closer to home, and I think, you know, that reduces even transportation, whether it's through hospital transport or patient transport, which inevitably reduce some of the carbon footprint. It reduces the overall cost. It's reproducible. That's the key. Really simple, reproducible. You know, while I spend a lot of time with other organizations kind of teaching and showing how to use this, but again, it's engaging the team, engaging the patients, you know, and getting that message across, and it makes a big difference. The future, I mean, I kind of, you know, I have a big thing about trying to digitize as much as possible, but also we have to accept, you know, not every patient will want to be on a digital pathway. Some don't have the ability. We found, you know, people say, oh, they're too old to use technology. We found actually the older patients were great. You know, they're always, you know, they have iPads, they have modern phones, and they could really adhere to this. But, you know, essentially what this MSK funding coming through is allowing us, I think, and some of the vision that we've heard from Andrew, is allowing us to look at that true end-to-end virtual pathway. You know, a patient goes online, they triage MSK to you know, to whether it's therapy services, whether it's just simply some online advice, or whether it's the surgical outpatients. You know, we then can do a lot of what we do virtually, whether it's consultations, whether it's scoring, whether it's pre-assessment. We can use interoperative technology, we can use robotics and AI learning to drive improved outcomes and reduce variability. You know, we can use those wearables and smart tech to monitor patients' recovery, you know, alerting the clinicians at the time when they're needed. You know, patients don't necessarily need us all the time. You know, moving away from that kind of model of care that, you know, as an orthopod, I like to see a patient at 6 weeks, and then at 3 months, and then at a year. Moving some of those kind of traditional method monitoring that we do. Enhancing that virtual consultation. You know, we've all moved into a virtual world, but what we're seeing is people creeping back to that face-to-face appointment. What can we do to enhance that, to, you know, to enrich that experience, so that, you know, whether you're sharing the x-rays, sharing content in that consultation, so patients and clinicians want to do a virtual because it's better than the normal face-to-face consultation. I think that's important, and I think that's where the wearable really helped. I knew my patients were doing well because I could see it on the graphs that I was getting, so I didn't need to bring them in to examine the knee to see where it was going. And I think that, you know, that will help enrich. You know, we can improve outcomes, we can drive you know, outcome improvement using AI learning. We can look at the pathways, we can have patients feeding back their outcomes that can look into an algorithm and say, you know, this patient's got a BMI of 32. Why don't you use this degree of cut? You know, and again, you know, and I know it's pertinent to the meeting that Melanie gave yesterday. You know, reducing the carbon footprint. you know, these virtual consultations, this virtual world will certainly reduce the amount of travel. And at the end of the day, we need to remember that obviously all of this, the patient remains at the heart of what we do, and we tailor everything to their needs, you know, and know that there's the option for the traditional approach, because, you know, as we know, not everybody has that ability to be to digitize everything. So I think we got there.
We
So
did
I'm going to stop
indeed.
sharing.
We did indeed, and as I said, we were going to have technical difficulties. I've had to have my fan blowing up my laptop as you've been presenting, just so it doesn't have a heat. But no, thank you for that, and we're more or less back on track, and it's nice really, because I know that you're excited about the digital world as well. You know, the stuff that you presented on the knee sensors is probably one of a small number of things that you want to do, and I know that you're doing other work on MSK and digitalizing pathways. So brilliant. Just a couple of real quick thoughts on me. Absolutely the patient at the heart. I think as well, some of the things I've wanted to introduce today are to help the staff, to help the front line. What can we take away that heavy lifting? You know, what can we do to enhance and complement the workforce? So I think we'll see a few things hopefully today. With that in mind, it's 22. I think if we can, we'll overrun by 5 minutes. So let's start at 1:45. And the reason being is let's go and grab a quick drink of water, let everyone get in the room. But then facilitators, if it's okay, let's start at 1:45. So let's just knock 5 minutes back. And then please, if you can, come back and join us, because Melanie Martin's going to, from NHSX, is going to reflect and ponder and give some feedback. And I think that's important to do that. So thank you for listening. Thank you, Graham. Thank you, Andrew. Brilliant. And thank you, everyone else. And look forward to hearing from you.
Thanks. Hi everyone, I can see that some people have joined a little bit early, so I was just going to let people know that I think one of the other rooms is still finishing up, so we should be rejoining shortly for closing comments. I can just see that Pete's rejoined as I started talking. So
no, but you're absolutely right. I've got it as 57 minutes, and we will start at 4. So 3 minutes, quick comfort break if anyone needs one, or a drink. It is hot. Thank you for bearing with us. I know it's a long day, but it's hopefully been fruitful, certainly as for the room, and we'll do some summaries at 4. So yeah, go and grab yourself a drink if you need to. Lovely, Mel. I saw your message. I just said we'll start bang on 4, just to give people time for a quick comfort break. I've put the slide in there if anyone wants to vote again, just on some of the questions. I'm not quite sure if it works. I'm not sure if we've broke Microsoft Teams today, because mine started playing up again when I came back into the main room. It kind of went a bit Pete Tong at the beginning of one of the breakout rooms, but we got it back on track.
Yeah, so did mine. It kicked me out properly. I had to shut down and restart, and I joined on my mobile just so I didn't miss some of the sessions. So yeah, I think it's something to do with the hot weather. Well,
I think it might be. I think it's hot weather, and maybe we're maxing out Teams a bit too much. But yeah, we're nearly on the home straight. So thank you for everyone that's come back and joined us. I mean, I was in Breakout Room 3, and I just really briefly summarised. You know, you can tell how much time and thinking has gone into some of this digital innovation from the companies. And I said I'd love to be able to help every one of you. You know, there's this. Yeah, I think everyone's got something to offer, and you know, it's lovely to see. So Mel, I'll hand over to you for closing remarks then, please, and then we'll let everyone go and relax. You're just on mute, Mel. Can you hear me?
Yep, perfect. Sorry, I will just I'll share my screen. Can you just give me a shout when you can see the full slide? And I'm just going to change my. Can you just see the whole of my closing remarks slide?
Perfect. Yeah, it says closing remarks. Yeah.
Okay, so it's 4 o'clock. The first thing I'd like to say is a huge thank you, and I will do so at the end as well. But Pete's just commented upon the hard work and the real patient sort of centric focus that all of the innovators I've certainly heard from this afternoon, the effort that everyone goes to. But I think we can all just join forces and say we know that today's event on a hot September day has been a huge undertaking. So thanks to Pete and the other facilitators, because I think it's been a fantastic couple of hours. I've got my window open just to let a bit of breeze into my little hot office box, but so do let me know if that is too loud. But I just wanted to spend the last 15 minutes of today, I suppose, summing up what I've heard. Just a little bit of background of myself. First and foremost, I've worked in the NHS as a clinician for over 25 years, and I've been a physiotherapist for those 25 years, and have moved closer to digital health over the last 10 years. And what I mean by that is I started to see problems in the services I was delivering, and I wanted to help redesign them and give patients a better experience and journey along them. So that's sort of my background. I've recently been a Topple Fellow in the Digital in the Topple Fellowship Programme, and I'm about to embark on the Digital Academy Cohort 4. So what I'm able to bring to my day job, I suppose, as a Senior Delivery Manager at the Innovation Team at NHSX, is learned experience of being a clinician and kind of having experienced those problems sort of firsthand. But now what I want to do through events like today is understand how those problems are changing. Are they growing? Are we solving any of them? And that's going to be really, really important to learn from you all. So what I've heard and seen today is that we've been able to bring together innovators with, undoubtedly there's clinicians within the audience. There's implementation experts that can take those challenges and look at how to solve those problems with the technology that's been presented today. And there's real experts in change leadership, and we need all of you, and we need to work together, and we need to come together as what I think we're all quite comfortable with the term used now, is a community, and we are around our patients and our citizens that need our help. So I think what I've already heard and seen from each of the rooms that I've been dropping in and out of is this real active listening. Like we've all heard and reflected on what others are doing. We've understood, it seems, what we're all trying to do, and we've responded positively by saying, I'll share what I'm doing, please share what you're doing. So I think that's what I'm able to reflect on, and I feel we're in a really good place to start going forward with some of the actions that undoubtedly will follow today. But I think Graham said it at the beginning, and Pete as well, is that we still need to join at the dots of this innovation. We still need to join at the dots of people who are really good at implementing this stuff, and we really need to learn from those change leaders that are doing it well before us. So joining at the dots is a real important ambition from events like today. So you may have seen me come in and go, but you're probably too busy to notice. But I'm the person in blue here. I've listened to as many of you as I physically could, and where the green circles are, I suppose you'd call us mystery drinkers or mystery shoppers. Two of my really great and brand new colleagues at NHSX have joined today to basically listen, do that active listening and hear what's out there, hear what problems you're solving really well. So we've heard from you all, and of course we've got the recordings to catch up. So what did I hear? So I heard that simple is best, said all. I mean, nobody has ever, as a patient, said to me, I really, really want my healthcare to be complicated and me to navigate multiple steps and hurdles. So, of course, simple is best. I heard we are the digital front door. Well, we've said that it's not digital by default, it's digital choice through choice. So that's really positive to hear. And that was from Clinic at the start of the afternoon. Graham, from his own keynote, spoke about putting patients at the heart of everything we do. He's not the only person to have said that today, but I think it's a really important quote for us to take from today. And whilst I share a similar vision to Graham, a vision to digitise as much as we can, again, our National Clinical Director for MSK, Andrew Bennett, said digital's not for everyone. So we need to make sure that we recognise that digital is an enabler and it's an option and it's a good choice for many. And for those that want to make that choice but need support, we need to upskill and provide that support. Pete told us from FIO about how important it was that, you know, his AI solution is 100% clinically safe. Of course it is. So that's really, really important to hear, and it gives us a great deal of confidence as clinicians. And so really moving on, I've heard from so many of you, and, you know, please don't, worry that I've misquoted you. I've tried to capture it in real time. I was listening, but I was also typing away. But Tom Gray from PhysiTrack told us that they've got a library of over, I think it's 100,000 high quality physiotherapy written videos and evidence-based materials. So what a resource that is. And Robert from Flex Health told us about how they are an upstream approach focused on prevention. And as we are focusing on an end-to-end pathway approach, a whole system, a whole pathway approach, that's really refreshing to hear. Malcolm told us about, you know, how important it is to use the knowledge that we can centralize, gather and centralize, so that data is actually a sort of active participant, and it's not just you store it and don't do anything with the data. We know that data is really important. And also, of course, Mark, and I think it was Concepta spoke about how important offering patient-initiated follow-up and the offering of a virtual assistant to reduce the time burden on our clinical nurse specialists. So we've heard so much today, or I've heard so much today. I tried to soak it all up. You know, Tom said about it's like having a physiotherapist in your in your pocket. I mean, so many of the solutions I've heard do offer that, and Graham spoke about it, and so did Harriet when they spoke about the BPM pathway device, is that the technology goes home with you, but so does it feel like the physiotherapist does as well. So that's really powerful. I've heard that from my own work in remote monitoring. And Ramsey said, of course, we're not going digital for the sake of digital. It has to add value. When we talk about digital in the commercial context, of course, it has to add value, both in managing the high demand and the reduced capacity that we've had through COVID times. But also, you know, it's about not taking a one-size-fits-all approach that Matt Booth from PhysioBuddy told us about. So it's about getting it right and adding value to those individual patients. And look, you know, there's so much more I could say here, but you know, we heard from, as I said, Harriet, about some of the impact that a digital day case pathway for total knee replacement surgery, what value that's really adding, you know, reducing that post-operative follow-up. That's really, really positive to hear. And again, we heard just at the end there from Tommy, and I'm just moving that little box up the way so I can come back to see what I've written there. Yeah, is that look, you've helped over thousands of patients. We've had thousands of patients to improve their self-care. This is absolutely important. Supported self-management, like Get You Better offers, is incredibly important at reducing the pressure on primary and community care, and on reducing the number of patients that are sitting unnecessarily on waiting lists. So that's what I heard. So who I think is here today are the innovators and you as early adopters. You are driving forward the digital and inclusive digital transformation of MSK to support the ambitions of the Best MSK Health Collaborative Programme and those of the long-term plan. And whilst we know that we need to support our colleagues who aren't in our virtual room today, those that perhaps need a little bit more convincing and bringing along with us, I'm relying on you all to be those early adopters and those innovators, and to take the spread and adoption of digital back out there across the wider system. Now, I think the only way that the NHS can meet the challenges of rising demand and cost and expectation is to use the digital technologies that you have presented here today. And really the ambitions and principles of NHSX, the organisation for whom I work with, it is to digitise, transform and connect, and not just for the sake of, but to really improve the productivity, the safety and experience and outcomes for both our patients, those in care and our workforce. So what would it be like if we as service or clinical partners, so clinicians in the room, have all the skills we need to thrive in our role, understand our patient population and understand our patients' needs through better links to our patient partners and the use of data? How would that really help to reduce digital exclusion, which is really the elephant in the room? We've really got to continually focus on that. But as our patient partners, what would they feel like if they were better informed about the choice of care available to them, what care they can access when they need it, for example, through a personalised care approach, through shared decision making? And what would it feel like if they really understood their own needs and preferences and could really share those preferences with their clinician in a a shared decision-making way. So finally, the sort of where are we now? I've heard about where we are now, and I'm really excited about the future. But there are some things that we need to ensure are in place and we don't forget about if we're to close that gap. And one of the ways that we can do that is through sharing good practice, best examples of where we're already making progress with digital along the MSK pathway. And that's come to life in the form of the Digital Playbook, which both Andrew Bennett, our National Clinical Director, and Pete has mentioned, and I have dropped the chat link into the main chat. So really, this is a call out, really, like Andy Bennett said, is we want more case studies, we want to hear from you, we want to hear about your great work and the progress and impact it's having. Because it's there to be a shared resource, it's there to be a repository of the great work, but it's also there to show the evidence base, that give the clinicians and the patients who use the services the confidence to engage with digital as an enabler for better care and better outcomes. So through the MSK Funding Award that was launched on the 12th of August, I invite you until the 17th of September to submit applications, to get involved and join this MSK community, to test new digital innovations across pathways so that we can all learn and understand better what works and what does not work. And together we can create and build that evidence base for to guide where we need to go in the future with innovation, and of course to address digital inequalities. So the funding has been created to support ICSs who have already an active interest in scaling or introducing innovation along the MSK pathway. At this moment in time, this stream of funding is not available to applicants from accelerator or ICSs, and this was of course highlighted to you in the webinar recording yesterday, and that will be shared later this week. So dates for the diary, if you're interested in applying or in the process, do look out for the recording of the webinar if you weren't able to attend. The closing date for the MSK funding is the 17th of September. And just so I'm completely transparent and honest about the process after submission, is they will be initially reviewed by regions to ensure there is good alignment to regional priorities, and then an expert review panel including patient partners, charity sector chief execs, the GIRFT members of the GIRFT team, and our National Clinical Director will be reviewing those applications, and the successful applicants will be announced the first week of October. So it's with a huge thank you to you all, to Pete and his team, and also for sort of giving me some time to just share my thoughts. And I'm going to take the buzzword, and I think it was Tom Booth who said this. Our buzzword at PhysioBuddy is collaboration. Well, that's my buzzword too. So let's really ensure that from today we collaborate on supporting our patients to live, to grow well, work well, and live well with best MSK health. Thank you.
Lovely, thanks for that, Mel. And again, I'll just take 10-15 seconds quickly, and then I will let people go, because those were 2 points that I wanted to finish on. I'm hoping people in this room, as suppliers of innovators, have seen things where you might want to collaborate on. I think there's definitely scope for that, and I heard from a couple of companies that you're already connecting, so that's brilliant. Funding, I've put the funding links in there. Mel's describing one funding pot, there is others. As I said, you might look at it and say, well, that's not for me because an ICS needs to fund for that. Think about what you can do to look at these opportunities, and it might not be called MSK funding, it might be something totally different. Take, if you can, a little bit of that ownership to search, sign up to our funding bulletin. I can see Mel's still sharing a screen, and I've got like a little widget of me on there, which is not amazing. But yeah, just thank you for your time. It is hot. We've had technical difficulties. We knew we would. But really appreciate your time, and as I said, there's so much effort gone into your products. They look really well polished. So Graham's just come back on just to put us all to shame that he can do knee surgery in between these events. I can barely put a Teams event on and flip between a meeting room. But thank you, Graham, as well. Thank you, Andrew Bennett, as well, if you're still on. And thanks to my colleagues for helping. So go and enjoy the sun. Go and have a drink.